am stopping in to say hello to you. I also would like to invite any of you in this room and anyone that you may know who need to hear and draw on these benefits that we're offering today, pearls of wisdom to help you through any trauma you may have experienced. Professionally, I am a nurse of 27 years. I'm also a life coach, and I have a lovely guest here, and I'm going to roll it on over to her.
Good evening, everyone. I am Marcia Sally. I am a licensed master's level social worker, coach, and transformational counselor. So, the goal here today is just to explain first of all, this is trauma part two, and we're explaining how trauma can go from shame to strategy. So, that means, whatever those feelings are, coping skills, adding coping skills and strategies to as a pathway for your healing.
Yeah. And we are so happy to have you here. For those of you who missed our live last Saturday, please look under the video files titled Live and look for the video that is labeled Trauma. This will be part two. And I would you like me to start with the questions that I have?
Sure, absolutely.
Now, I have a few questions regarding trauma, this title, Going from Shame to Strategy. And I was wondering if I would just start off with the number 4 question that I had on my list that says, what does it mean to move from shame to strategy in trauma recovery?
So, moving from shame to strategy means shifting from self judgment to self understanding. So basically, instead of asking ourselves what's wrong with me, which is what trauma does to us, making it feel like it's trying to paint that identity onto us as if whatever happened was our fault. Questions we could ask ourselves are questions such as, what happened to me? What was my nervous system trying to tell me at the time? Or, you know, also letting us know that in that moment, the nervous system was trying to help us survive, right?
Yeah.
So, also, what tools do I need right now? So, instead of dwelling on and what happened in the past, it's like we can go over it to help process it. But what do I need right now? And also embracing strategies brings choice, skills, and compassion to your trauma in order to help you get to the healing process. Shame keeps people stuck in the past. So shame creates feelings of self-doubt, while strategy creates a pathway forward.
I see. And how does the shame often develop after trauma, even when the person was not at fault for what occurred?
So shame often forms because trauma disrupts a person's sense of safety and self-control. So the brain looks for meaning in the traumatic events or adverse experience, and many survivors turn inward, thinking something must be wrong with me. While shame becomes a
Hmm.
survival response, not a character flaw. So that's basically the shame is like a survive, like that is how people survive it, but it's not a character flaw. It's you being human. And sometimes being human is all we have. But when we get new information, and it gives us that chance to grow and get past those moments. Um, Also, it's the nervous system trying to explain pain when accountability actually belongs to the event itself or that adverse experience, not to the individual who actually went through it. Shame is learned in trauma, but is not evidence of any truth.
That's good to know. And what is the difference if you could help us understand what's the difference between guilt and shame relating to that trauma recovery.
So guilt says I did something wrong, while shame says I am something wrong. The difference is guilt opens up the door for reflection and learning. For an example, how could I do things differently? While shame shuts your perspective down, pushing you into survival mode. And survival mode is, again, just learning how to survive. And when you go through a traumatic experience, you get stuck in survival mode. Meaning, as you go throughout your life, if you don't deal with the trauma, you're stuck in survival mode, which means throughout your life, you're responding to things as if you were being traumatized, right?
Yeah.
So I may overreact. If I'm still traumatized, my response to whatever just happened may be over the top versus the way I could respond in a healthy way.
Yes.
So it's getting stuck in survival mode, always feeling like you have to defend yourself. That's what survival mode is all about.
Wow.
But when we give ourselves, that grace to say, every day is a learning process. I am worthy of change. Even though I went through a traumatic experience, I don't have to stay there. I have the ability to give myself permission to walk forward. Walk
Mm.
forward knowing this is not good. The painful experience I actually went to and through in the past does not have to follow me for the rest of my days.
Yes. It's something. It's pretty powerful. Thank you for explaining the differences between the two.
And also, I wanted to say in trauma recovery, unresolved shame is
Mm.
more damaging because it attacks identity, not behavior. While it may play out in our behavior, of course, because we see ourselves from an unhealthy place, so we will do things that, you know, are not healthy for us, make decisions, be in relationships, just making decisions based off of a broken perspective. But resilience begins when clients learn to separate who they are from what happened to them or how they coped at the time. And
Mm.
that's what I was trying to explain before. Just first of all, a technique I would like to introduce is called affect labeling. So, affect labeling is naming your emotions, which reduces the intensity of the guilt and shame. So, research shows that naming the emotion reduces the intensity and gives you more control, right? But self compassion is a performance enhancer that gives your brain the safety needed for emotional growth. So, self compassion means recognizing that your reactions are normal responses to abnormal circumstances, not your personality flaws, right? Or personality failures. It replaces self blame with curiosity, harsh judgment with gentleness, shame with understanding. So, compassion keeps you from weaponizing your trauma or adverse experience against yourself. So,
Mm.
that's blaming yourself for what actually happened to you. Resilience for people who've been through trauma. One statement I would suggest is I adapt to survive. So that means while I was in that traumatic experience or going through whatever that was, I adapt to survive during that time.
Mm.
But now I get to choose how I heal.
Mhm.
The more we rehearse that we are not the problem, the more your brain will look forward to evidence to prove that.
That's something else. And riding on the coattail of what you just discussed, how can resilience coexist with shame, even when the client or the patient they don't feel strong? How
Okay.
can they be strong when they don't feel it?
Okay, that's definitely a good question. because they kind of seem like they go together. But resilient doesn't always look like confidence or motivation, first of all.
Mhm.
Um, Sometimes resilient looks like getting out of the bed when you don't feel like it. You know, it's like no matter how I feel today, I'm going to get up and I'm going to push forward anyway. Resilience could also look like showing up for therapy or simply staying alive during an unbearable moment,
Mm.
right? So,
Right.
shame often hides resilience by convincing people that their survival doesn't count, right? Because it's not pretty, it's not done in a way that is perfect. But the reality of nothing that happens is like in life, far as a process goes, is linear. Meaning it doesn't happen on a straight path or the one, two, three, four. It happens, first of all, it's individualized. What is it going to take for me as an individual in my healing process? And what do I need? What skills do I need to help process my pain? Because what might accommodate somebody else for their healing process, it may look totally different from me. So I can't expect it to be like a one way path. It sometimes it can be all over the place. I could be okay today, I could be down tomorrow. It's
Mhm.
about consistency. Consistency, collaborating, working with people who actually support you for real.
Right.
Because you know, some people will fake like they support you and they really
Yeah.
don't. But it's just like showing up regardless of who or what and saying, you know what, I've been through enough. So now this is my time to push forward. This is my time to tell myself you are worthy. You've already been through, I'm going to say hell.
Mhm.
So at this point in life, what else is there but to stand up to whatever's been haunting you in your mind and just say, you know what? We're going to get through this. We
Mm.
are going to get through this.
That's right.
It's having the confidence in yourself, painting a picture in your mind that I can do all things through Christ that strengthen me. I, like I said, I can't say it enough. I have been through so much already. I refuse to give up because I am resilient. And some days I may feel shame, but then I have to deal with it. I have to identify and label those emotions in that moment. What am I feeling? What about this is actually true? What is fact about it? And then standing on that and saying, you know what? These are the facts. Yes, I've been there, I've been through it, but today I'm choosing the path of healing and
Mhm.
whatever that process looks like.
That's awesome. Those are wonderful tools to help us through. And
Yeah.
my last question is, what are some of the practical ways that clients or those of us we can begin replacing shame with strategy?
Okay. Great question, sis. You
Thank
came up with
you.
some good ones today.
Thank you.
So, clients can begin their transition by naming shame without obeying it. So that's some I sort of kind of just said that. So basically naming it. So for an example is this is not shame. It's not a fact, right?
Right.
Also tracking your triggers instead of judging reactions. So what you're going to do is notice patterns without blame. And an example of that is I felt overwhelmed and shut down after a conversation I had with someone, right?
Mm-hmm.
But instead of telling myself I'm weak or feeling like, I'm too emotional, I noted the loud voices and feelings that were underneath. Um, and feeling misunderstood tend to triggers this response.
Right.
So let me explain that a little bit more. So basically, what I'm trying to say when we tracking our triggers is again, we could be talking to someone, it could be anything that triggers you.
Mm-hmm.
So we're already fighting every day with those intrusive thoughts. So just recognizing the feelings that are being misunderstood tend to trigger these responses. So if I feel like, I'm sensitive to certain things and somebody kind of label me as that, then I may in my head think, you know what, there it is again. It must be true.
Mm.
But then I have to challenge that and said, no, there's no truth of that. I'm not perfect, but guess what? I'm moving forward despite what the voices in my head say, despite the fact that shame wants to tell me that this is who I am. This is not who I am,
Mm.
right? So it's like, despite that, I'm going to move forward. I'm going to put my best foot forward, getting up every day saying, today is a good day for change, and I am worthy of that.
That's right. Feeling worthy is important and being able to redirect ourselves in those moments when those.
Also, I'm sorry.
No, go on. I'm sorry.
And I'm sorry, and I was going to say also separating the trigger from identity. So when my heart raced and I became irritable, right? That's one
Mm.
example. I wrote down what happened right before lack of sleep and stressful. So basically, when my heart raced when I was triggered and I became irritable,
Mm.
I wrote down what happened right before, and that was lack of sleep or feeling stressful from a meeting or stressful from some situation rather than labeling myself again as too emotional. So again, with triggers, we go through things and instead of labeling ourselves in a negative way, we can look and see what were the vulnerability factors that caused me to respond in a way or feel like I was going to respond over the top. And it could be something as simple as before I encountered whatever conversation it was or whatever that situation was, I was already exhausted.
Yeah.
I
Yeah.
came exhausted already. I was tired or I had a fight with a friend or something happened that already had me on edge. So it's just identifying that and realizing I wasn't too emotional, but also, again, always thinking in our head, being intentional
Mm.
when we know we're exhausted. When I deal with certain situations, I have to learn how to take a pause. It's okay to say, let me walk away for a minute or excuse me so that I don't say something where I regret because whatever we do and say has consequences. And that's why it's important for us to be intentional. Using curiosity to guide strategies as well. So, an example of that is I observed that my body tenses when plans change unexpectedly, right?
Right.
Tracking this helps me prepare grounding strategies ahead of time instead of criticizing myself. So, these are all examples of triggers, right?
Yes.
Building coping plans for moments of dysregulation.
Mm. That's good.
That's yeah, that's very important. We all go through moments of dysregulations, but when we notice early signs of dysregulation, such as rapid breathing, yeah,
Yes.
right, heartbeat, muscle tensions, or racing thoughts, we have to again take a pause
Yes.
and name what's happening. What am I feeling? Why am I feeling it? And what can I do in this moment to try to minimize those emotions and those feelings? And again, stepping away from the situation if possible. Take
Mhm.
3 slow breathing breaths. Also, place my feet on the floor firm for grounding because we
Mm.
definitely want to do grounding, making sure we're present in the moment, and reminding ourselves that we're safe.
Right.
Reminding ourselves that we're safe, and then I can choose one regulating action, such as drinking cold water, taking a brief walk before deciding how I'm going to respond. And also practicing self compassion as a skill, not a feeling. So, the reason why we want to practice it as a skill and not a feeling, because we want to make sure that this is something that we try to put in our routine daily self compassion. Encouraging yourself, reminding yourself who you are, where you came from, and what it took for you to get to where you are. Resilience is not um, being tough. Resilient is I survived to be here to talk about it. right?
Right.
Um, Also, notice, step back. These are examples. So, practicing self compassion skills. These are examples that I wrote down. That choose a calming technique. So, calming technique could be, again, I think I just said this, noticing how you feel, stepping back so that you can regulate, then respond. Also, we talked about pause, breathe, grounding, and choosing a common action and celebrating regulation over perfection, right?
Yeah.
So, what that means is honoring emotional pauses, celebrating the times where you took a moment, stopped, and breathed, and chose not to react, even in a situation where you still felt uncomfortable, you know?
Yeah.
So, it's like why this helps in that moment is because it helps you focus on the progress, that you're doing, and it builds self-esteem, it motivates, and long-term recovery. So
Yeah.
it's actually letting it's never going to be perfect, right? At least not when you first start, but gradually, giving yourself credit for those small wins, just noticing. Again, labeling, how am I feeling right now? What just happened? What emotion am I actually dealing with? Is it anxiety? Is it stress? Is it depression? Labeling what emotion you're going through and how your body is responding to it. Because remember, we talked about the body keeping a score,
Hmm.
which means that even though we know trauma is psychological because trauma actually changes and rewires the brain, meaning that trauma actually changes the way you see yourself. It kind of raises the alarms, for whatever that event was. So it's like now that I've been through that traumatic experience, my nervous system is wired differently. So
Right.
I see things in a whole different perspective because at one time in my life I did not feel safe or I did not feel protected. So now I am again in survival mode,
Yes.
right? So
Yeah.
it's recognizing partial progress. Acknowledging that you regulated faster than last time,
Yes.
even though you still felt anxious and needed support.
Hmm.
Valuing safety over performance, feeling proud of setting boundaries, or taking a break instead of pushing yourself to handle it perfectly. So each of these strategies enforce the truth that healing is a process, not a performance. So we don't have to fake healing for anyone. We have to realize this is our own. We have to own it, take accountability for what our individual process is going to look like, knowing that shame asks for you to hide your feelings and what you've been through, but resilience is invites you to heal, right?
Right.
But strategy empowers you to move forward with intentions. You are not broken. You are responding, and with the right tools, support, and understanding, recovery becomes not just possible but sustainable. So that means if taking that time with yourself, embracing that, you do need help in this area and getting the right help and paying attention to what you do and how you navigate these different coping skills and strategies is a way that it can become permanent for you where you don't you move further away from that traumatic experience. It's like, yes, I know that happened to me, but now I'm dealing with it in a more healthy way. Now
Right.
I can look at it and know that was not my identity. Something that happened to me, but I am resilient because I'm still here. I'm
Hmm.
still fighting. And also recognizing that my story is clearly connected to somebody else's story because someone needs to know that we got through it.
Yes.
Someone needs to know that they can also get through it. So it's like your healing depends on somebody is watching you. Somebody needs to see God glory in your life.
Mm. Wow.
So it's very imperative for us to know that it's just not about us. It's about everybody connected to us, literally.
Literally.
It's like, how am I covering my sister? And not, it doesn't have to be blood sister. How am I covering the people around me? Because sometimes people will judge you for the same things they've been through, right? They
Yes.
will literally judge you, and it's amazing. But that's what we have to do, while we're healing, is realize I don't want to do that. I want to
Mm.
be able to cover somebody, because regardless of whether I know it or not, when I was going through whatever I was going through, somebody had me covered in prayers.
Yes.
And that's why I'm grateful to have a praying grandmother, Ida Leak, and a praying mother, Mary Elizabeth Harrison,
Yeah.
praying sister, just people around me who I know, regardless of what, they are in my corner. And that is important because not a lot of people have support.
Yeah.
So that's why it's important for us to continue on our healing journey, because someone out there don't have all of that.
That's true.
So with me healing, then I could go encourage someone else and
Mm-hmm.
let them know we may not be blood relatives, but I'm here for you. What do you need? Is it resources where I can connect you to a psychiatrist or therapist, or is it a group? Because group therapy works. Not everybody want to go to an individual therapist, but group therapy works because it's a good networking tool.
Yeah.
You get with people, you may hear some strategies of how they've survived, and that helps you realize, oh, that could work for me. Or you may be doing something that you don't realize could help someone else. So we're on this earth not just for ourselves or to be selfish, but to realize that everything we do have to be intentional,
Mm.
because someone needs to know that you survived and that it's possible, and
That-
also that it's necessary.
That's right. And I was thinking along the same lines. It really takes having some good connections to
Definitely.
be, yes, to be able to get through what you're going through. And not everyone is blessed to have what we have: the praying mom, a praying grandmother, aunties, uncles, our brother, and we have many of other family members. But um, we were raised in the mindset of prayer changes things, and prayer is very powerful. Um,
Mm-hmm.
in numbers, right? When we come together and we talk about things, because you can be going through something, and who knows, maybe I have been experiencing something similar, and I didn't, that was my opportunity to be able to relate with you. Oh, I felt the same way. Oh, okay. And this is how I can overcome that. These are tools that I can put in my life's backpack to help pull me through those times.
Exactly, and also that's really good. Um, when it comes down to all these things, it's the biggest tool I feel like to learn when you're talking about trauma is cognitive reframing. How do I change my perspective of how I once saw that trauma
Hmm.
to the fact that I am resilient and I have survived thus far? Also, emotional regulation is what we talked about when we was talking about our responses to people, based on the trauma. If
Hmm.
our emotions are, or our responses are higher than what they're supposed to do. It's that emotional regulation piece. What emotions come up, when I'm going through something, and how do I start doing little steps now before I even get to certain incidents? How do I start working on my emotional regulation now? And that's just by day labeling of how am I feeling?
Hmm.
What do I need in this moment? Paying attention to what's going on in my body, grounding techniques. And when you feel vulnerable, you know, like being exhausted or tired, or just having something going on in the background before you got there, could be, that very thing that takes you to unfortunate circumstances. So it's breaking that chain of because like I said, it could go from the vulnerability to what happened, the person coming up to you saying something or something triggered you, and then an unfortunate outcome. So, how do I break that chain before it gets there?
Yes. When that heart starts racing, right? And you feel like you can hear your your heartbeat
Yeah,
outside of your body because you have that rush of emotions. But yes,
exactly. Yeah,
being able to tap in and regulate that in that moment.
exactly. So
Thank you.
that's it. It's just like I said, we all need someone. We all need to learn how to show people, love without judgment. How do I again cover my sister or my brother
Yes.
without judging them, understanding with an open mind and considering and seeing them as human,
Yes.
because as humans, we have a way of judging people for the silliest things because we are human, but it's knowing that I'm human. So then when I do feel those judgments coming, I got to say, no, no.
That's right.
How can we reframe that cognitive reframing? How can I change my perspective of how I'm looking at this person or what they're going through? And also just adding empathy. How do I apply empathy to their situation? How can people trust you if they don't feel safe to share?
Yes. Yes. Yes.
So, yes.
Well, you have given us some tools to help us along this journey of recovering from trauma. And it is my prayer that whomever this video comes across, that God will open up your understanding and that you will be able to utilize these pearls just to help you through and
Yes.
to get you through another day. And just hold on, be strong, do not give up. And if you hold on, you will make it to the other side of what you're going through.
Absolutely. And remembering again, you are not broken, you are responding. And with the right tools,
Yeah.
support, and understanding, recovery becomes not just possible, but sustainable.
Yes. That's wonderful. Thank you so much
You're
for
welcome.
giving us more information on how to move through life and how to just intercept these moments that can overtake us, but to help us build ourselves up to be stronger.
Yes,
And
yes.
as we get through one situation, it helps us to get through another. So thank you again.
You're welcome.
And thank you, everyone, for tuning in once
Yes, thank you
again.
for joining us.
Yes, we will be back with more discussions on trauma and other topics that we may come up with. And should you think of any topics that you would like for us to cover,
Yeah,
please put it in the comments. Please put it in the comments, and we will get back to you and we can develop a video to bring more information to you. Okay?
that's right, because building community is necessary so that we all grow.
Yeah.
And in the day and times that we're living in, it's a lot of people dealing with high levels of anxiety,
Mm-hmm.
dealing with the uncertainty that's going on in the world. However, we can build community here to support one another.
Yeah.
If you feel like you don't have a support system, that's what we're here for. Let's have a conversation about things that matter and things that actually push us forward.
Yes. Thank you so much. Amen to that.
Yeah.
And what are we gonna do, sis?
See you in the next video.
We'll see you all in the next video. Be blessed, be
Yes,
well, and
yes,
do not allow anyone to steal your joy.
yes.
Have an amazing rest of your day.
Amen.
Amen.